Welcome, everyone. Good afternoon. Thank you for joining us for this very special Facebook Live series. My name is Irina Polanco Ventura, and I am the Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. We are here today to talk about the Maternal Action Plan, or known as MAP, which was launched this week by the New Jersey Healthcare Quality Institute. This document complements the Nurture New Jersey strategic plan and outlines 4 key areas to improve maternal health outcomes. There's a lot of work to be done to ensure safer births for all, and we are very well aware of the dire statistics that exist. Unfortunately, when it comes to maternal mortality rates, New Jersey is lagging significantly compared to other states. Here, Black women are up to 7 times more likely to die during childbirth than white women. Maternal mortality is a public health crisis that we must address now to ensure quality care for all families. One of the strategies in the MAP is creating a more diverse, culturally congruent, and respectful workforce, which is why today we are discussing part 1 of the MAP plan, which is diversifying healthcare workers in the maternal infant health field. During this conversation, we will focus on the role of doulas and lactation consultants in supporting safe births and healthy families. I am honored to be joined today by Chanel Andrews, a certified lactation consultant and the co-president of the New Jersey Breastfeeding Coalition, and Jill Woodnick, childbirth educator and doula. Thank you both for being here today. I'd like to start off by having each of you introduce yourselves and talk a bit about your work. Chanel, would you mind starting us off?
Sure. Hi, good afternoon. I am Chanel Andrews. I'm an international board certified lactation consultant, or IBCLC for short, because saying the whole title takes a half hour in and of itself, right? I am the current sitting president for the New Jersey Breastfeeding Coalition, as well as a private practice IBCLC here in Southern New Jersey.
Thank you, Chanel. Jill?
Thank you so much for the opportunity to be here with everyone. My name is Jill Woodnick. I'm a childbirth educator through Lamaze International. I've been a doula for about 20 years, and I work on improving maternity care through policy systems and programs at Montclair State University.
Thank you, Jill. So I have a few questions here for you all, and I want to talk, of course, a little bit about the recommendations that the MAP has outlined. But first, I want to talk a little bit about what brought you to being in the maternal infant health field. I know that for a lot of us, including myself, I am a trained doula from many years ago. Oftentimes it's our birth experience, our birth stories, it's a calling. But tell me a little bit about what brought you to this specific field. Jill, would you mind starting us off?
I was actually a high school teacher for 7 years before I really wanted to just move to doula training, doula formation and care, and childbirth education services. And like you said, Irina, it really was a calling. And I was very interested in just centering and dedicating the work time I had to be with other women and people with labor and giving birth. It's a rite of passage and a significant life event, in addition to holding education, health, and resources.
Thank you. Chanel?
So prior to having my 2 now medium-sized humans, I was an elementary school teacher. I taught 4th grade inclusion in Camden, New Jersey for 2 years before my husband and I decided to start our family. With my son, breastfeeding did not go the way it was supposed to go. We eventually got on track, but there were a lot of bumps and hurdles that we had to get through. A couple years later, when we had our daughter, it was a totally different story. I kind of felt more seasoned and knew what I was doing. And so, because of that, I became the breastfeeding unicorn in my circle of friends and family because I also had pumped an extensive amount of milk and had saved it only to have to donate it because my daughter was fresh off the tap or put it back. So, because of that, I started getting a lot of messages. Friends and family were sending people my way. Oh, ask Chanel. She knows everything. She does all the breastfeeding things. And I'm like, okay, this is weird, but I'm gonna, answer all the questions that I possibly can. It was through the urging of one of my close personal friends for me to become a titty tech. That is what she titled it. I I did not know that lactation consultants, that's the actual title of the credential. I didn't know that it was a thing. I hadn't heard of it. And when I looked into the qualifications to do it, it looked like something that I could do, and I was very, very interested in. I mean, it's only so many pictures of boobs, babies, and breast milk and poop that you can get before you're like, okay, how do I make a career out of this? And so
Yeah.
that's how I landed in the seat of studying to become an IBCLC.
Thank you. Thank you for sharing your story, Chanel. I can totally relate. I had a less than perfect experience breastfeeding with my first, and I said to myself, this is not going to happen again the second time around. So I educated myself and certainly, became almost like how I call myself a peer expert without having the credentials. But I love that term, breastfeeding unicorn. Totally relate. Thank you for sharing that. So some of the questions that I have for you all today, we all know that having a baby isn't as straightforward as it seems, as you've, of course, illustrated for us, Chanel, through your experience. Can you share stories of families that you have worked with that have faced challenges and how a lactation consultant or doula were able to make an impact?
So, with many of the families that I see in private practice, they're all, having difficulties on varying levels, right? So, we have some parents who the baby is not latching properly, or the baby's not taking the bottle correctly, or my insurance company sent me this wonderful pump with 75 pieces. What do I do with this? And, just the bare basics. There's a baby screaming and they want me to do something, and I don't know what the something is. Please help. So being able to get that, skilled care to come in and make it make sense for them. One thing that I actually enjoy doing is giving parents the aha moment, right? Because before I came into the home, there were a lot of other things at play that happened that led up to this point. And before even getting into the clinical care of fixing the problem, I like to take parents back to help them understand this is this is what happened. This is what led to this. And I do that oftentimes because parents feel guilt. That's the first initial feeling that we feel when we're unable to do something as simple as feed our babies, right? What am I doing wrong? What am I not getting right? And most of the time, it's not anything that you have done. There were these interventions that were put in place that you may or may not have known about, because medical consent is still kind of sketchy sometimes, so it's like this happened and then this is why this happened. And it's that, oh, it's not my fault. It's not your fault. And so let's build up from there, because now I have to rebuild your confidence as a parent. I've had parents in tears because they have swollen breasts and flat nipples, and they're like, I cannot latch my baby on. Tell me about your birthing experience. Oh, you were in labor for how many hours? Were you given IV fluids, honey? Oh, well, listen, let me tell you what happened to all those IV fluids. And, there they have babies, and they have significant weight loss. Has your baby been urinating a lot from all those hours of being hooked up to an IV, and everyone's full of fluids? And so, it's just as simple as making it make sense for the parents, while also like letting them know it's not your fault, and this is how we're going to learn and build from this, and this is how I am going to help.
Thank you, Chanel. Oftentimes parental guilt is there for many reasons, but oftentimes parents don't realize that the support systems aren't there for them. So that's so important, everything you said, thank you. And Jill, I wanted to ask you, tell us about the immense impact that doulas have on families, specifically community-based doulas.
Yeah, so community-based doulas are really centered in a trusting, caring relationship, like all doulas. Probably the iterative difference is an acceleration of resources, of really making sure that caring for a family with dignity and respect, and also knowing zip code, county, regional specific ways of being for supporting families. And that could be anything from mommy and me at the local library for infants to really making sure that any of social, emotional, community health needs are met job fairs, making sure that there's safe housing. So really honoring that birth is happening in a community, in a neighborhood, and in a family. And so while the focus is, of course, safe and healthy birth, understanding that families may need linkages or just visible resources for more than only pregnancy.
Thank you, Jill. And a follow-up question for you is, one of the recommendations of the MAP is to increase the amount of culturally congruent folks that are working with families. Tell us why that is so important.
I think it's really essential to make sure that families have representation that feels a sense of being, of belonging, and attunement that is both verbal and nonverbal in many different iterations of identities. And also just making sure that there's geographic access. So a family in Sussex County doesn't have to only have a doula down in Salem County, right? And so that's the strength of the MAP program, is to strengthen and enhance pipeline for community-based perinatal health workers. So we have perinatal community services in every zip code.
Thank you, Jill. Thank you. That's so important. And speaking about pipelines, Chanel, I'll reference this question to you. One of the considerations of the MAP is collaborations among professional organizations, licensing boards, educational institutions. So opening up pipelines, but together. How is the New Jersey Breastfeeding Coalition working to increase diversity in the profession? And what have you found to be the biggest barriers?
So right now, the New Jersey Breastfeeding Coalition, we do have a task force or a committee that is dedicated specifically to diversity. We currently have a scholarship available for individuals in marginalized communities who want to become IBCLCs. We have a scholarship to pay for the exam fee because the exam fee is a little on the hefty side. We also are currently designing and piloting a lactation professional navigation program to also help those who want the lactation credentials other than IBCLC, because although the IBCLC credential in lactation is the top tier, there are a lot of other credentials that you can obtain before getting the IBCLC, and they are often found in our clinics and other community based projects as well. And so the NJBC is working to do those things to help increase diversity in the lactation field. NJBC also just appointed its first Black president as well. Hi, nice to meet you. To also increase the diversity, not only within our membership, but our executive board as well. Um, and so one of the biggest hurdles that we actually see with this is employment opportunities. After we support these candidates in getting the IBCLC, the CLC, CBS, CLE, where are they going to work? Because that's a very important part of it. Private practice, while fun, it is not accessible to everyone. So being able to open up those lines, for example, to work in a hospital, not having to have the RN to be the IBCLC there, those things are definitely going to be very important in order to increase accessibility and diversity to these credentials and lactation support for family.
Thank you, Chanel. That is so important. Opportunity for employment. It's not only about the training, but opening up those pipelines for folks to get jobs in these areas. So I think we have about a few minutes left, and I have one more question for you, Jill, specifically. Chanel mentioned the whole employment conversation right now. And I know that throughout the state, there have been a series of successful doula pilot programs run by community-based organizations. So tell us a little bit about the success of those. We know you're an advisor for Community of Caring, the Patterson Doula Cooperative. How is a program like that and other pilot programs promoting a more inclusive maternal infant health workforce?
Yeah, so all of the community doula projects in New Jersey and all doula trainings that are centered in the acknowledgement of reproductive justice really start and understand the issues of racism, patriarchy, and social determinants of families in poverty that are different than racism and patriarchy, but are still part of the water that families are living in. And so that real acknowledgement of centering care, centering support in oftentimes unjust, unequitable experiences. And so with that, how building a trusting relationship and centering on maternal health care can be a fuel for both justice as well as joy in the work with families. The community doula programs have been successful because they are acknowledging the giving birth and being born that is happening through transformational relationships and recognizing those areas of where there's power and privilege, and then how, you know, really there's so much talk about credentials, and the heart of doula care is relationship based.
Absolutely.
You teach anatomy and physiology and an assessment, but the willingness of humility to care with love for someone in front of you is so much of the spirit of tenderness.
Thank you, Jill. Thank you so much for ending for us this on such a wonderful, beautiful note. And that is all the time that we have today. I have truly enjoyed this short conversation. And I want to thank Chanel and Jill for joining me today. I hope all of you have found this session informative as I have. I urge you to read the New Jersey Healthcare Quality Institute's Maternal Action Plan, which can be found on their website, and really consider ways you can be part of the change and help advocate for the changes in order to ensure safer births for all. I hope you can join us for part 2 tomorrow at our next Facebook Live, focusing on the role of data in improving maternal mortality rates. Take care and enjoy the rest of your day. Thank you.